We need to be able to share imaging studies between different hospitals because our patients are not static. They go between different hospitals. It's just a fact of life. So how do we go about making this easy? Well, there's a profile that allows us to share imaging studies between hospital enterprises. Let me show you how. Let's talk about XDS-I.
Hey, I'm Brad. I'm a healthcare integrator in a vast ecosystem of healthcare applications. We connect these applications using standards like HL7, FHIR, and DICOM, and bring it all together with IHE, thus making the world a better place for all, for doctors, for nurses, and ultimately for the patient. This is Healthcare Standards and Profiles. So, cross-enterprise document sharing for imaging, or XDS-I, allows us to share imaging amongst different hospital enterprises. So for example, we could access images from a rural community clinic as well as a city hospital. Or perhaps we might have a general hospital and an oncology center where two or more different distinct enterprises have images for my patient, and I don't want to pool them together because they're different legal entities. And it works by having a centralized registry. It could be at one of the sites or in a central location where we publish references that these individual hospitals have imaging for my patients. I can then query and see what's available and then talk to the individual repositories and the image managers behind that to be able to retrieve the imaging and related metadata. Let's take a deep dive in how it works. The basis for XDS-I revolves around this idea of registry and repository. When we populate our repositories, we start from the imaging document source. This could be a PACS, for example. It creates a key object document of what is in our imaging study and publishes this to the document repository. The document repository then informs the document registry that this itemized list of an imaging study exists. Then later, a document consumer, this could be at another clinic, for example, a physician's office, will query the registry and look for all of the related imaging study documents available for the patient. We might consult PICS to do our generalized lookup of patient identifiers. The registry will come back and tell us these are the repositories and these are the imaging study documents available. So our document consumer will go to the repository and pull down that inventory for an individual imaging study. It then looks at that and then knows to query the imaging document source to actually retrieve the DICOM files themselves. And then that imaging document consumer is then able to show the imaging study. And with that, if you'd like to learn more about XDS-I or any other IHE profile, visit ihe.net.
And with that, now you know how we could share imaging across multiple enterprises using XDS-I. Let's go do something great.